Welcome to a Spotlight on the Work series. Today we're talking to LeaSuwanna. Thank you for joining us.
You're welcome.
Can you please tell us who you are and what you do?
My name's LeaSuwanna Griffiths, and I'm currently training to be a nurse. But not only am I training to be a nurse, I'm making the NHS pay for me to become a nurse. So I'm a nursing associate. I end up being a nurse with no debt.
The best kind of nurse.
Yes.
And whilst you're training, what does your job entail? What are you up to at the moment?
I am currently classed as a HCA, so I'm a healthcare assistant. I get paid as well as I'm training. The nurses will take me away to go learn something that I can. So I'll do catheter removals and things that the nurses will do, but I'm just not allowed to give any drugs.
And what's the catheter removal?
They put in a catheter in your veins so they can draw blood or sometimes give you medicine. So we use a non-touch system. So you try not to touch anything, but still do things. And you avoid touching certain areas so you can't pass infections, and keeping it as sterile as possible. And I get to play with them and remove them. I'm actually the ECG queen at the moment.
Ooh, how did you earn that title?
Because it's something that the HCAs don't do, is the nurse's role. So they always just call me to do them all. So annoying, because you have to put all these plastic bits all over everybody's body, then monitor their heart, take a picture of it, get the doctor to look at it. If they think it's fine, then you take all these stickers off of the person, and if they're hairy, they're getting a free wax.
Oh.
And it's not, and the places I have to put them is like 3 underneath on your breast or your groin, so I get to see the whole patient's body as well.
Is it exactly like an episode of Holby City or Casualty, or if you're old enough, ER?
No. The patients are sometimes grumpy, but no, there's no, I'm lucky enough to not be on one where there's a lot of drama. Because I'm on respiratory, but when I do the heart, when I go on a heart ward, they literally have wires coming out of their heart that are giving them little electric shocks to keep it going. And it's just sitting there and you can see it just beeping, and that's someone's heart working.
That's so fascinating. Oh my goodness. Okay, so of course you're here because you're living with HIV and you're working. How have you navigated being HIV positive at work?
There's no way that I can actually hide that I'm HIV positive, because I'm very open about my status. So all they had to do was Google or look on my Facebook or anything and see that I put that I'm positive. With occupational health, I disclosed straight away. I shared my status because if anything was to happen, I wanted to be able to be reassured that they had my back and I was safe to be working in this environment. And as far as I'm concerned, it's a part of me, so it's not going to affect any of my patients.
And I know that you said you're open. Would an HIV positive person who isn't as open as you have to tell their employer about their HIV status?
Your actual employer doesn't know your status, only the occupational health. So my actual boss doesn't know, not unless I casually tell them. It's still kept within a bubble, but a safe bubble.
Nice. And for anyone who may not know, what is occupational health?
Occupational health is, they assess how safe the environment that you're going to be working in, if you need changes. So if I had a disability, they'd make adjustments to make sure I could work there. If I suffered from migraines, they'd make sure I'd be in a light, a certain shadow area of work. And if the computer screen needed changing, they just work with us to make sure that we can work.
Thank you. And what would your advice be for anybody who wants to get into the healthcare profession as well, who's young, living with HIV, thinking about a career path?
Basically, you can, it sounds really, you know, blasé, but you can do whatever you want to do. As long as you put in the hard work, you can be whatever you want to be. And if there is a block, there are organizations like Chiva and NAM and NAT that will help navigate getting through that block, because we should be able to do as we would like to do. If you wake up one day deciding you want to be a doctor, go get it.
Go get it the exact same way. We should go get it the exact same way that you're doing it as well. I can tell you, I would trust you with my life. And it's so good that you're enjoying it as well.
I do. The patients are lovely. Even the grumpy ones are lovely. They're in an environment where their family aren't coming to see them. Their whole lives are in basically the palm of our hands. Our decisions and how we treat them is not, they have no control over it. So if they're a little upset about what procedure they have to have done today, or even down to the simple fact that most of them can't go to the bathroom, I have to change them. That is, you're a grown adult having someone else change you. It can make your mind feel very like at the lowest point, and we have to make it be as respectful as possible. So that's what I have to do. I have to be nice, which I like being naughty.
Which you're amazing at, as well as being a little bit cheeky. True. Thank you so much for joining us, ECG Queen. We appreciate you sharing your wisdom.
Thank you.